Still, I think the only thing I have to do is check for notices. Counselor inquiries. I don't think there were any. I wouldn't know, to be fair. I just was chairing at the last minute. So we'll do notices of motion. Hearing none, this very brief audit committee is now adjourned. See most of you in 7 minutes. Thank you, everyone.
That was efficient. No,
Wouldn't you? Who doesn't?
okay. He's the chair, man. Blame him.
Andrew, isn't that your role? Like, if there's any issue that we've got, we should just blame you personally.
That's fair. I'm willing to accept that.
All right, I'll work on my Photoshop skills.
By the way, Mr. Knack, you are looking very professional.
Thank you. Is that just today or normally? Because if I don't normally, I better step up my game.
No, you always do.
Thank
Get a haircut.
you. You had no other way to answer that question. I didn't give you a choice there. You weren't going to say like, "Nah, you look like a slob, Andrew," the rest of the time. Especially because now we're actually live, so everyone gets to hear this wonderful conversation. Happy New Year, everyone.
Are we live? Well, Happy New Year, Edmonton.
Oh yeah, you got the radio mic. Yeah, take us away now. Your radio mic. Can you play us a song?
I cannot. Copyright infringement. We're on YouTube. We'll get taken down.
Looks like you had some time to paint.
A little bit. Yeah, I got a little bit extra done, but now I've run out of time again.
I have a confession to make, which is that I have a dream that one day I will be able to say that I have like an Aaron Paquette painting in my house. Because every time I look behind you, it's like these glorious colors. So I'm being realistic. It's not like it doesn't come easy, I don't think.
Good afternoon from Council Chambers.
Well, we
I do
often
believe
forget
we've
to
had
lock
some
our
people
doors, so, you know.
just join us on the conference line. Could you please confirm who you are, please?
Hi, it's Dave Seekin, AHS Edmonton Zone Medical Director.
Thank you so much. Anybody else just join us on the conference line?
It's Christopher,
good
Officer of Health.
Thank you.
And Carol Anderson, Chief Zone Officer for AHS.
Thank you so much. Sorry to interrupt.
Okay, something's different with my device here. Is it 3 and 3 in the usual? Got new system software in here though, eh? All right, Happy New Year, everyone. We'll call to order in a minute. Just, I did not anticipate
Yeah, it's been taking me a few minutes.
a systems change here. That's on me.
Okay, you see me as no. Yeah, there it is. Oh, new chairs.
Yeah.
It felt different.
Okay, got it. Good, good. Okay. Oh, my bookmarks are gone. It's okay. Maybe I just forgot my password. I don't know. It's been a couple of weeks, right? Well, I just can't get the streaming running off this computer, but I can do it off here. And I guess I don't need to be broadcasting, so whatever. Let's get started here. I'll see if I can get it online, but I just look tired anyway, so maybe it's better if my camera's not turned on. Let's call this Emergency Advisory Committee meeting to order. I'll recognize that we are doing today's meeting, albeit largely virtually, on Treaty 6 territory, which is the ancestral homeland of the Cree, the Dene, the Saulteaux, the Blackfoot, and the Nakota Sioux peoples, as well as one of the great homelands of the Métis Nation here in Canada, and a gathering place for settlers and descendants of settlers from all over the world, in fact, trying to build a better and safer city together. So we'll call forth that spirit as we get today's update. Of course, we have two meetings today. Back to back. It's a bit of a technicality that we'll do EAC, and then we'll have a quick break and have a special council meeting, because the meetings are for different purposes. So bear with us. I do need a motion in a moment to adopt the agenda, but before I do, I will roll call and perhaps just wish everyone a happy new year, and maybe express gratitude, especially to those frontline workers in the city who, particularly our first responders, but everybody who worked through the holidays here, and including on the statutory holidays, to continue to serve Edmontonians during this extraordinary time. And hope that everyone else who had an opportunity to get a bit of a well-deserved rest was able to, and we'll try to make today as painless as possible. But it's important that we're here, and I thank members of council for tuning in for this. I'll start attendance with Councillor Knack.
Yes, good afternoon, Mr. Mayor.
Thank you. Councillor Cartmel. Oh, I have the audit committee list, that's why. Hold on. Councillor Knack. I'll come back to Councillor Cartmel. Councillor Knack is here. Councillor McKean.
Happy New Year.
Thank you. Happy New Year. Councillor Nicol.
We received notification that Councillor Nicol won't be here.
Okay. Understood. Councillor Paquette.
A very happy new year.
Thank you. Councillor Walters had let me know that he has a regional meeting that he's at right now. He'll join us as soon as that finishes. So he'll join in progress. Councillor Banga.
Happy New Year, everyone.
Happy New Year. Councillor Carmel.
Good afternoon.
Good day. Councillor Katarina.
Hello.
Hello. Councillor Zadek is here in person.
Yep.
Nice to see you. Councillor Essinger.
Happy New Year.
Happy New Year. Councillor Hamilton.
Happy New Year.
Thank you. Welcome. And Councillor Henderson.
And a Happy New Year from me also.
Thank you. And it is Christmas on the Julian calendar, I'm informed as well. So however you're celebrating today, welcome. I need a motion now to adopt the agenda with the simple inclusion of item 3.1, but nonetheless we need that. Councillor Essinger.
So moved.
Thank you.
Second. Oh, no second needed.
No seconder at committee. I'll just, do you want to try a vote?
I am checking my co-pilot. Yeah, we'd love to try a vote.
Okay. I of course will need to get into the meeting to do that, but let's try. Let's. I know some work has been done around this, so let's.
We can do verbal if that's helpful, Mr. Mayor.
Well, let's just give it a moment and give everyone a chance to get logged in, present in the meeting, and because we'll need this for the council meeting in a little bit, so let's just make sure it's working here for everyone. But don't go into the special audit committee meeting. Go into the emergency advisory committee meeting. Ah, there's the vote.
Councillor Paquette?
It didn't come up. I'm in the right meeting, but I'm a yes.
Thank you. We have all the votes, Mr. Mayor.
Thank you. Display the vote. Carried. All right, minutes, December 10th. Councillor Knack.
Thank you, Mr. Mayor. Yes, I'll move the adoption of the minutes from the December 10th, 2020 Emergency Advisory Committee meeting.
Thank you. Any questions, concerns, errors, or omissions? Not seeing any, please vote.
We have all the votes, Mr. Mayor.
Display the vote, please. And that's carried. Protocol items. We'll not seeing any now. We will have one at the council meeting. This is probably more appropriate. So, selection of items for debate. There's only item 3.1. We have no speakers. So let's dive straight into item 3.1. And thank you, Mr. Laughlin, to you and through you to your colleagues for keeping an eye on all of this through our recess and for your report today. I understand you're off a well-deserved couple of weeks of break to be here today, so thank you for your diligence throughout this time in this crisis, and thank you in advance for your presentation. Go ahead.
Thank you, Mr. Mayor. Happy New Year, members of committee. And this afternoon, joining today are Jennifer Kluth, our chair of our COVID-19 task team, obviously the members of our executive leadership team, Ms. Andreychuk, our city solicitor, and Dr. Chris Sikora, the Edmonton Zone Chief Medical Officer of Health. And I also heard a number of other AHS folks, so they'll be there to answer any questions. So the impact of the provincial restrictions and the challenge of halting the spread of the virus is the bulk of this update. Enhanced provincial restrictions were announced on December 8th to prohibit social gatherings outside the household and to protect the integrity of our health system. The restrictions have forced significant changes to lifestyles, have effectively shut down several city services, and required Edmontonians to experience the holiday season in non-traditional ways. We await the outcomes of the province's review of the current restrictions, which may or may not provide new direction and orders going forward. Protecting those experiencing homelessness has been an ongoing challenge as the active case rates surged in December, and we have an update on how the pandemic shelter operations have performed through the holiday period. And finally, we will discuss the issues and immediate challenges that lie ahead for Edmonton and the city. The health impact of COVID-19 in the Edmonton zone continues to be serious. Recently, data trends have begun to show some decreases in the active number of cases, hospitalizations, and ICU admissions. But the numbers are still high, and Alberta Health continues to analyze the data from over the holiday season. The trend in outbreak locations is a significant factor in the active case increase. AHS is reporting increases in acute care, long-term care, and extended care facilities. There have been some minor but notable increases in correctional facilities and other institutions in the region as well. These are expected consequences of broader community transmission. Alberta Health is closely watching the emergence of the COVID variant in Europe and Africa, its spread, and its effects. Vaccine supply and distribution is still in the early days, and I'll talk about what we know about the rollout later in the presentation. The prospect of lasting virus protection for Edmontonians provides hope for a foreseeable end to the pandemic. That reassurance is incredibly important as we begin 2021, but it would be a mistake to ease off on public health practices before immunization is broadly available to the public, which is anticipated in this fall. We have a responsibility to find the right balance between restricting behaviors and slowing the spread while offering hope for a COVID-free life later in 2021. Municipal enforcement officers and peace officers have been actively monitoring and enforcing business restrictions in compliance with the face covering bylaw and social gathering restrictions. With their expanded authority, city peace officers closely coordinate with Alberta Health Services environmental public health inspectors as members of the public safety compliance team. The city, EPS, and AHS environmental public health inspectors actively enforce the Public Health Act. Their approach to the public and businesses continues to be open and approachable with a focus on education to gain compliance first and ticketing as required. Compliance continues to be good. Enforcement actions relate primarily to issuing warnings. Over 1,200 in the December 10 to January 4th period, warnings were issued. In the past 4 weeks, though, 98 tickets have been issued related to the mask bylaw infractions, and 9 tickets have been issued for infractions against the Public Health Act. Anti-mask, anti-lockdown protests continue to occur in response to public health restrictions, although protest activities subsided over the holiday period. The Alberta Legislature Sheriffs manage all demonstrations held on the Legislature property with support from Edmonton Police Service as requested. And the Edmonton Police Service works proactively with protest organizers to ensure expectations are clearly established and consequences of behaviors are understood. The demand for shelter accommodation during Christmas, between Christmas and New Year's period was stable, and no new outbreaks were declared in temporary shelter accommodation sites. The shelter at the Commonwealth Stadium was removed from the outbreak status on January 6th. Currently, there are over 800 shelter beds that are 24/7 in the system, and the demand on the system is approximately 80 to 90% of capacity. All 250 temporary shelter beds at the Edmonton Convention Centre are regularly full. The site was recently named to Tipin Awa by Elder Rose Wabasca during a naming ceremony. It is a Cree name that means sheltered from the outside elements. The Commonwealth Stadium temporary shelter is operating at 80 to 100% capacity overnight, approximately 120 people. The Mustard Seed temporary shelter is operating at full capacity, approximately 82 people. The Edmonton Isolation Facility operates 75 spaces for those who have been diagnosed with COVID and those who are close contacts awaiting a diagnosis. Over the last 6 weeks, the Edmonton Isolation Facility has gone from being at full capacity to approximately 35 to 50% capacity. COVID-19 rapid testing was trialed at the Edmonton Isolation Facility, and Alberta Health is looking into rolling it out into other shelters. The city, the provincial government, Alberta Health Services, Homeward Trust, and partner agencies are engaged in planning for 2021, and this includes determining a plan for when Tipin Awa will close. The week of January 12th is the expected time frame for the province's review of the current health orders. From that review, updated direction regarding the severity and scope of restrictions may be provided. The city is prepared to respond to the orders that would be either maintained, enhanced, or relaxed for slowing the transmission of COVID-19 in our community. Edmonton Health Zone data trends seem to suggest that we have made small positive steps in controlling the spread of the virus, but we have more work ahead to truly flatten the curve. Edmontonians are to be congratulated for their efforts to limit interactions with those outside their household. We thank them for their sacrifices that they have made during the holiday season. But the situation is still serious and dynamic, and we depend on all Edmontonians to remain focused on and committed to making our community safe. The city will continue cautious but hopeful messaging, encouraging Edmontonians and Edmonton businesses to stay the course and commit to the basic public health practices for as long as there is a transmission threat. The City of Edmonton has partnered with regional cities, Fort Saskatchewan, Leduc, Spruce Grove, and counties, Strathcona and Sturgeon, for a COVID-related Enjoy Winter Safely video and social media messaging. Regional cooperation is vital during this pandemic as COVID-19 knows no borders. The video has been shared by each municipality as well as to organizations like the EMRB. As part of the province's community engagement plan, outreach initiatives have been introduced to support Edmonton neighborhoods experiencing high community spread of COVID-19. Red Cross volunteers have dropped off 42,000 household personal protective equipment kits to residents in 7 hotspot neighborhoods, and more kits will be distributed through selected schools in January. An Edmonton community outreach table has been developed, bringing together the local knowledge, networks, leadership, and assistance of ethnocultural serving agencies, NGOs, the City of Edmonton, and the Government of Alberta. By disseminating COVID-related information, materials, and other resources, the goal is to continue to engage with and support the needs of those most vulnerable in known hotspots. Administration will be focusing its 2021 efforts on facilitating the distribution of $1.6 million in provincial funding through the community outreach table. In terms of vaccinations, all of the initial over 30,000 doses of the vaccine have been delivered to frontline healthcare workers and staff in long-term care and supportive living facilities. Our understanding is more supply is expected to be received next week. What we've learned to date from the implementation of the provincial immunization plan is that this is not a quick fix. The logistics are complex, and distribution and access approaches are likely to undergo change to adapt to realities on the ground. Here's what we know so far. The federal government is responsible for supplying COVID-19 vaccine. Alberta Health is responsible for vaccine policy setting and allocation of the vaccine. Alberta Health Services is responsible for administering the vaccine as part of the provincial immunization program. The 2 COVID-19 vaccines currently approved by Health Canada, the Pfizer and the Moderna vaccine, require 2 doses of the vaccine for full protection. At this time, the Pfizer vaccine is approved for those over the age of 16 years, and the Moderna vaccine is approved for those over the age of 18. The province is using a phased approach to immunizations because of the availability of supply is still not certain. Alberta Health and AHS started immunizing targeted health care workers in December. These groups were selected based on their level of interaction with COVID-19 cases and their vulnerability to exposure to the virus. Throughout January, Phase 1A immunizations will expand to include more healthcare workers and all residents of long-term care and designated supportive living, regardless of their age. In February, Phase 1B will include seniors over 75, no matter where they live, First Nations, Métis, and persons 65 years of age or others living in a First Nations community or Métis settlement, and healthcare workers in medical, surgical, and COVID units or operating room. Phase 2 will begin in April and run to September. The key populations for this phase are still to be determined, but will continue to focus on targeting those populations who are at risk. The vaccine will be likely available to the general public starting in Phase 3, which is expected to be in the fall of 2021. In the meantime, it is critical that everyone continues to follow the public health orders and guidelines to combat the spread of the virus. The city is monitoring the phased rollout of the vaccines and developing our plans for employees. Our rollout will include education about the importance of vaccines to slow the spread of the virus, to support our healthcare system, and to protect our families and community. At this time, Alberta Health's immunization sequencing does not include priorities for other high-risk occupations like our fire services. The current focus is on those who are at highest risk of severe outcomes or those who are working with those who are at risk of severe outcomes. We understand that broader input will be sought on prioritization. The city will continue to advocate for priority vaccination timing for our frontline first responders. We understand that there will be no distribution of the vaccine through pharmacies until later phases. 2021 will bring new pressures that we must consider and address. ELT is in the process of looking at a range of issues and critical decisions that will affect our services and service delivery in the near term. Up for discussions are issues like shelter transitions in the spring, how to sustain and support adherence to restrictions while immunization rolls out, and the potential impact of a third wave. Of course, the impact of a prolonged pandemic on mental health of Edmontonians and employees continues to be the top of our list of concerns. Administration remains committed to keeping the community safe throughout all phases of the pandemic, and we appreciate the opportunity to keep the Emergency Advisory Committee informed of our actions. Concludes our update, and myself, members of ELT, Ms. Kluth, Ms. Andrzejczyk, and our folks from AHS are happy to take any other questions that you have. Thank you.
Thank you. We've got a speakers list forming up here, starting with Councillor Knack.
Thank you, Mr. Mayor, and thank you for the information and to all the city staff who sort of worked tirelessly over the holiday break while it was a very, very stressful time. I can't imagine, and not being able to be with family made it that much harder, I'm sure. So I wanted to ask a first question about what we can expect. You touched on it a bit in your presentation for January 12th. So are we... It certainly sounded like from what the Premier said last night that we shouldn't expect any major shifts that day. And so I don't think we'll have to sort of react quickly if suddenly restrictions were lifted. But are we prepared if by chance January 12th came forward and most of the restrictions were lifted to potentially bring in our own to address what is still a quite high number and the R value is not where it needs to be and all of that?
And you've heard me say this before, Councillor Knack, thanks for the question. The approach that we would take is to digest what has been shared by the provincial government and then take the necessary steps to respond. At this time, from the city's perspective, based on the cases and I articulated in the presentation, we still feel we're at a high risk in the city, and particularly around the city services. I think it's, regardless of the announcement on the 12th, it's premature to activate anything from our perspective. But of course, we will. We're eager to hear what gets announced.
Yeah, and my hope is that you would get some advance notice. My worry would be if we're, and I don't foresee this being the likely scenario, but if a lot of restrictions were lifted, and we are still where we are, which is nowhere close to below the November 12th numbers, which is really, I think, where we want to be, far below, not just at November 12th numbers, that you could suddenly have a week go by of things get completely reopened before things come back in, and that might not be a great way to make sure we're all sort of working together towards a common goal. So I wanted to know that if in that what I expect would be very unlikely scenario, we're ready to act more quickly if we felt we needed to.
We will be, but just from the City of Edmonton service perspective, we're not, regardless of what gets announced, I don't anticipate us jumping to open or reopen services.
Yeah, absolutely. I'm more thinking about we had that conversation just before the restrictions came in about what tools we had to do things beyond our facilities, and I wanted to know if we were prepared to use those if we felt they were absolutely needed and react quickly. So I hear that
Absolutely.
We could if we needed to.
Yes.
Okay. Maybe from a AHS perspective, and I realize I know the Premier had back at the beginning of the restrictions talked about the R value. That was one of the indicators or measures that they were using and hoping to have that, I think, at 0.8 or less before you'd even begin to consider things. Are you able to share any other measures that we might be looking at now to help inform that? I imagine it's not going to be exclusively R value. It's things probably like active cases, hospitalizations. But do we have any more insight as to some of those targets? And maybe specifically, we had this chart that I don't know if you had access to that shows what our cases were and our hospitalizations were on November 12th and where we're at as of yesterday. We're nowhere close to even what we were on the 12th. And I imagine we want to be far below what we were even at the beginning of November before we'd start making some major changes or adjustments. Is that fair to say?
Dr. Sikora, thank you.
Yeah, I'll try to respond to that, Councillor Knack. No, thanks for the question. It's a good question, and I can't. It's difficult to predict what exact metrics our Government of Alberta partners will be utilizing to make those decisions overall. But what we can do is provide insight as to what has been happening over the past 2 to 3 weeks. What we have seen is a decrease in the testing volume, so fewer people have actually gone for tests. But of those that actually have gone, we've seen a persistent high percentage of them, or a high fraction of them, do remain to be COVID positive, and that's the test positivity value, and that still is fluctuating somewhere between 6 and 9%. So we do have still high rates of COVID-19 circulating in our communities overall. Absolutely, lower test volumes, likely related to Christmas, New Year's. Did cause a bit of a dip and a decrease over the end of 2020. Although, we're starting to see those numbers come back up. I think our testing volumes yesterday were almost, 80 to 90% of what that baseline was in mid-December. And across the province, we had 1,100 cases identified. And, that sort of, when we put that into context, our highest numbers in mid-December, early December, were around 1,800 to 1,900. We still have almost 500 COVID cases in our hospital environments, with 60 to 70 in our critical care, in intensive care environments themselves. People spend a lot of time in hospital as a result of COVID-19. So we're not out of the woods yet. If anything, it's difficult to interpret what that decreased testing volume actually means for where we are in the pandemic itself. If anything, we're at a plateau, might be a best guess. And even an R value as being reported by our partners at Alberta Health of 0.92, which is good, has to be interpreted with a grain of salt, just due to those testing volumes that are impacting the COVID case numbers that are being actively reported. 0.92 is in the right direction, and that's good. But even with even with case numbers of 300 to 500 per day in the Edmonton zone, it's going to take a heck of a long time for those case counts to come down to more reasonable levels, and certainly even a longer period of time to allow our hospitals to be able to have some more breathing room to care for others.
Okay, great. Thank you. I'm out of time. I might have a few more questions. Thank you, Mr. Mayor.
Thank you. Councillor Henderson.
Yeah, I just wanted to take this chance to check out loud on a story. I think we all got this email, and I think part of the question's already been answered. It's actually a member of the media, but they phoned me on a personal basis to sort of check out what was happening. And it was a situation on White Avenue. And an answer they got from the from the people that they bumped into at the time who were peace officers. I think it turned out, and I've got an email back today, that they were not our peace officers. So that may have addressed part of the confusion. But the issue originally arose over going into a store where there was one person who came in without a mask. I think they asked the question about whether or not that was appropriate or allowed, and the answer they got back from the clerk was it was okay to have one person in the store without a mask. And I think that's what they wanted to raise. So there were some confusion pieces there. So I really just asked the question here because I think just to get clarity on, I think we need to take these opportunities to be clear about, what is and what isn't allowed, and to get some sense about what the protocols are for businesses when somebody comes in without a mask on.
I'll I'll start, and if others want to add, they can. But the approach with masks is that all wear a mask unless there's a legitimate exemption that has been identified, and that's in all indoor facilities. So to be crystal clear, everyone wears a mask unless they have an exemption.
But what does an exemption look like in this? Because I know that was one of the issues that came up before, and I think that I'm sure that is still really hard on proprietors to understand how to deal with people who aren't wearing a mask. How do you show that there's an exemption? How do you deal with that? And there still seems to be some confusion out there, and that's why I thought it would be good to ask the question out loud.
So I'll get folks to help with this, and maybe Jen can. The exemptions are the same as the exemptions, or very similar to the exemptions that we had in our mask bylaw. Unfortunately, there really isn't, and recall the exemption card process that we tried to utilize. There really isn't a mechanism other than trust that the individual does have indeed a legitimate exemption.
Is it still ultimately at the discretion of because I think there are probably some businesses that are saying, are being hard and fast and saying no mask, no entry. We'll serve you in other ways, which I think is a legitimate response, and probably an easier response for the business themselves. But I'm just wondering, what kind of choices the businesses themselves have enabled in dealing with this question, because it may affect their business for their other customers to feel comfortable as well, which is part of what they struggle with.
A business does have, it's their right to refuse service. What we've been trying to do, working with the various agencies, the BIAs, is to help them with those situations, and we've talked about more curbside pickup, more opportunity for web service. So we continue to do that, but at the end, you've said it right, it's the business's discretion in terms of how they accommodate folks.
So they do have the ability, though, to set their own rule and say no mask, no entry, regardless of this question of exemption.
That's correct.
Okay. Good. I just wanted, that was my understanding. Where this idea came of, it's okay to have one person in there, I think was a bit odd, which is, I think, what raised this question to begin with. And I think probably in that case, I don't want to mention the business, but, there's probably some education that has to happen there. It was with a particular clerk. So, I just thought it was worth asking. Again, I think the more we can be clear about this and keep on sort of stating what it is, the easier it is for businesses to understand, how to respond in these kind of situations, which clearly is putting some of them in difficulty. So thanks for that. That's essentially my question.
Thanks, Councillor Henderson. Councillor Banga.
Thank you. A couple questions for Dr. Skora first. My first question is about infection rates. The latest numbers show around 455 per 100,000 people. How is that compared to the rest of Alberta?
I don't have the Alberta number immediately handy, but when we look at our regions across the city of Edmonton proper, we do see a wide variety. So, for example, Twin Brooks has an active case rate of about 230,000 per 100,000, but that's compared and contrasted with Woodcroft East, which has an active case rate of 650 per 100,000. Overall, across our city, we have 12 neighborhoods or large geographic areas that have a case rate over 400 per 100,000. And that is fairly consistent across our Edmonton zone itself. Many of our municipalities, I should think almost all of our municipalities have case rates or active case rates that are well over 200 per 100,000. And that's very similar across the province. Just the exact provincial numbers I don't have on my fingertips right now.
Okay. And when an area or neighborhood gets labeled as the high numbers, what does it take for that neighborhood to come off that list there? Like, is there a specific number, or is there what criteria do you guys use?
It was criteria set out by our partners at Alberta Health, and I believe the trigger points were 50 per 100,000 for that first level, and I think it was either 100 or 200 per 100,000 for that second level.
Okay, and one more question for you. This we're talking about flattening the curve, and these two vaccines so far, they're only for people 16 and 18. So how do we manage these folks because they could be the main spreaders of virus? So do we have any plans as far as Alberta Health Services concerned to take care of that?
That's a great question. And I think it goes to the approval of, I guess, it goes to how vaccines are approved in Canada. For any new vaccine product that hits the market, they always have to go through Health Canada approval. And Health Canada looks at two major things: safety, efficacy. And when they go through that safety and efficacy profile, they accept applications from manufacturers. Manufacturers can only apply when they have sufficient studies that show proof of safety and proof of efficacy. Now, I am aware that Pfizer and biotech and the Moderna products themselves had their safety and efficacy studies in those two population groups, the over 16 and then the over 18. That allowed them to have those very large-scale trials of tens of thousands of individuals to be able to prove those two key things, which allowed them to have approval for use and sale within a Canadian environment, a U.S. environment, UK, or a European environment. And that's allowed our Alberta population and Edmontonians to be able to have as fast access as possible. The aspects of under 16 and under 18 are underway, so that I know the manufacturers are going through those trials themselves to ensure that once those trials are in a more completed state, they can use that data to further apply to regulators, Health Canada being our Canadian one, to be able to allow their use with evidence in that younger age population. So once we find out, we'll be able to certainly add that to our repertoire and our scheduling and our delivery across our population. Just we have to take our lead from our partners at Health Canada and, of course, Alberta Health.
Thank you. My last question is for our EPS and BILA partners. There was a situation, I guess, in Calgary that somebody had to be physically tackled and it went all viral. Did we have anything to that extent, or we were okay with the lower level of force or enforcement?
Sorry, can you?
So I think what we'll do is, Councillor Banga is a little over time here, so we'll try to make sure we have EPS connected, and on the second round we'll come back to the question. So, because we're having a little trouble hearing, and I think they may have had trouble hearing us too. So stand by. We'll come back to you, Councillor Banga, on the second round, and we'll work with EPS to make sure we can all hear each other. Okay, thank you. Councillor Hamilton?
Thank you. I'm going to shift a little bit because I think a lot of my colleagues have asked I would say, pretty good questions with respect to the issues that we're still seeing in the city. But we did have a transition over the holidays of our emergency radio system. And I received comments from members of the media that this transition meant that there's no longer public access to the public airwaves where emergency calls are coming out. And this includes fire and police. And I only was notified of this very late in the process, to be honest. We got notified at the same time that the radio waves transitioned. And I'm wondering if there's any thing in the works to actually have, I understand there may be concerns about public access to, or unfettered public access to radio waves, but at least access for members of the media to be able to continue to have that transparency that I think we've had in this province for a long time on both our fire and police airwaves.
I see Chief Satilny is on the call. He may be able to help in a response to that, and if our EPS members are able as well.
Yeah, my apologies, Councillor Hamilton. I don't have an answer for you right now, but let me look into it and get back to you.
All right, it has to do with the Alberta First Responder Radio Communication System. I was just looking for that. So yeah, I'd appreciate an answer on that today. I know the one of the answers that came back was that communications would be handled through communications advisors within EFRS and EPS. But I think it's pretty fair to say that those folks don't work 24/7 and oftentimes aren't able to provide official comment until much later in a state of emergency. So I think this is an important issue to address. So thank you. That's my questions.
Thanks for that.
Thank you. Councillor Zadig.
Thank you. So if I heard correctly, we're expecting in the stage where the public gets the vaccine at a wide scale to be in the fall. What's our current thoughts about how the summer is going to unfold? Are we currently planning for our typical and regular summer festivals? What's the thoughts with the parallels of the vaccine rollout and irregular activities that would occur in the city of Edmonton?
Councillor Zadig, Rob here. So our civic events folks are working with all of our festival groups and trying to do some scenario planning to determine, crowd size, distancing, and all the requirements the GOA have. They're fingers crossed. They're certainly trying to determine what a legitimate festival program would look like. Smaller numbers likely, and the requirements maybe to extend the duration of some of the festivals. But that work is underway. There's no definitive green light or red light at this point, but certainly those festival groups are certainly anxious to try to launch something in the summertime or the festival season. And they're hoping that they can go down that path, but nothing is guaranteed, obviously.
Yeah, absolutely. There's a lot of uncertainty, but it's optimistic to hear that we have some contingency planning happening. Thank you. Moving on to the comments that the City of Edmonton may maintain restrictions that are currently in place at the provincial level but localized here. Is there any thought around best practices for notifying businesses if we are going to take such steps, which I'm not suggesting we should, and I'm not. I just want to know if we were going to keep, say, gyms and restaurants closed longer, what would be our communication plan and how would we do that?
Just pausing to see if Catherine was on the call. Our approach would be through our regular channels, our website, our connections that we have with those various stakeholders, the liaisons that we have for the various businesses and BIAs. And again, we'd have to assess the actions the province takes to determine if we need to take a different course of action. So to the previous question, you said iterative, and again, this would be iterative if there was a significant change from the province.
And just to augment that, if I may, we do have robust communications channels in place through our colleagues in UFCSD. So we would work with them to ensure that we could reach businesses with messaging. Thanks.
Yeah, for sure. I would suggest that as long of a lead time as possible would be important for businesses staffing up and ordering supplies. I know that's kind of obvious, but I think where we might have had some issues in the past with mask rollout and other issues is just only having a day or two notice. So I'm thankful that we're evolving as we're going, and we don't know what's happening with the province yet, but it's the small businesses that are not always part of BIAs. For example, there's no BIAs in Ward 3, but there are many small businesses as an example. So I think getting the word to them is important. Thank you. Moving on, for bus service, I understand the philosophy, and I think it's great that we are not reducing bus services like we have in the past in order to ensure that we can have social distancing on buses. But just over this past week, while elementary schools have been out, I'm hearing that the school specials have been running at the same rate. I thought maybe we would reduce those a little bit, but I look to the city for guidance on that. Have we reduced the school specials over the last week? And if elementary schools and junior highs are not in session next week, I don't know what the announcements are going to be, but what's our thoughts around that?
I'll ask Gord or Ms. Houghton McDonald to respond to that.
Well, Councillor, we do make regular adjustments for school specials as the school years move through. I'll have Ms. Houghton McDonald just provide some specifics in relation to this year and how it's been rolled out.
Thanks, Gord, and thanks, Councillor, for the question. Yes, we do make those adjustments. We put out extra service when the schools are attending in person, and that would be our plan. So if kids are going back to school next week, we would look at adding back that service in order to meet the demand.
So just, with my last 5 seconds here, I guess the question in a way was, did we reduce bus service over the last week while school is out or this current week?
Yes, that's my understanding. We responded to that change.
Thank you.
Thank you. And Councillor McKean got bumped from the list somehow, tragically. So with regrets and our deepest sympathies on the loss of your place in line, Councillor McKean, you're up next.
I blame the clerk. I don't know what she's doing, but just a point of privilege, Madam Clerk. I'm using eScribe on my computer and did seem to get bumped inexplicably. Nothing I did, I assure you. But if I need to buy you coffee or something, let me know.
Did you turn it off and then turn it on again?
No.
Sorry. Carry on, Councillor.
I haven't done that yet. I was contacted this week by Mustard Seed, and it was served as a really good reminder to me that we have done the right thing in thanking our frontline healthcare workers, our city administration, our bus drivers, and all those people who have to go to work every day out there in the world, and how privileged some of us are to be able to work in safety at home. But I just wanted to recognize, Mr. Mayor, all the folks, many of them not particularly well paid, who are looking after our homeless populations in shelters. And that is hard work. And so I just wanted to publicly, if you don't mind, not a question here, obviously, I just wanted to take a moment to thank them, as I did for the folks with Mustard Seed. But I worry about missing some, but I know, Bissell and Boyle Street and Hope, and I suspect Bent Arrow and many others are doing this work, and I just wanted to say how much I appreciate it. In related news, and I hope EPS is on the line, continue to get some very frustrated and fearful people emailing in about the amount of social disorder, break-ins, vandalism, in particular areas of the ward I represent, Ward 6, and camping nearby. And I just wondered, I know everybody's running as fast as they can, but is there any way that we could focus on an area where some of this is happening? I don't want to name the neighborhoods, to be honest, but I'd be happy to do that offline. But is there a way that we could send the police or send bylaw down to look at what's going on, maybe make recommendations to the homeowner, or we could even look at escorting some of these people from camps into, I understand we only have 80% capacity in our shelters, and whether we could be compassionately moving people out of areas. Thoughts from EPS or from you, Mr. Smythe?
Councilor. Sorry, Dean Hilton, EPS here. Thank you, Councillor. I can say yes, we do have our divisions. They're aware of some of that, but definitely if there are specific issues and specific areas of concern, we now have our disruption teams and our community crime suppression teams that we are starting to implement into areas like that. I know we are working with City of Edmonton as well around the camps. You mentioned camps in there, and I know they're working with the social agencies in terms of response to camps when we come across those, and I know they're tracking that religiously there. So definitely, Councillor, if we can get that information forwarded to us, we will make sure that someone from one of those teams gets a hold of that stakeholder and try and address the concern.
Yeah, just to amplify on that, we'll circle back with you, Councillor, and get the details from you, and we can certainly pursue that. Certainly with the warm weather has been, some individuals are choosing not to use some of the shelters, and we're trying to be on top of that. But you're exactly right. There are certainly more than a handful of camps that are out there that we're trying to address. But we'll circle back with you to focus on those areas that you've been informed about.
Rob, thank you. I really appreciate that. That's all for me, Mr. Mayor. Thank you.
You are most welcome. I don't see the list in front of me.
So the next speaker we have, if I can just confirm, and councillors, there is a small link on your iPad that you should be able to click to see the list yourself. I've got Councillor Esslinger, Councillor Paquette, followed by Councillor Katarina on the first round. For second round, I've got Councillor Knack, then followed by Councillor Banga. We're just refreshing the display, but eScribe is correct.
Got it. Okay. Councillor Esslinger, go ahead.
Thank you. I appreciate all the questions so far. I just wanted to confirm with Mr. Seabrook, I believe. I think when we had our last emergency advisory, we talked about transit drivers being encouraged to wear masks even though they're behind the plastic screens. I've had a few emails from people about that. Could you clarify?
Councillor, we did implement mandatory mask usage for bus operators regardless of being behind the shield or outside. So that was action shortly after the last EAC meeting.
Perfect, because I've had a few comments that's not always happening. And that was my understanding as well. Thank you. My other question is, I saw on the news last night that some community league rinks are having challenges with people not following the rules. Do we send bylaw officers to check them on a rotating basis, or just when there's a complaint? And the other part is, how do we, with that communication on that part?
Councillor, I'm not clear on the cycle of if it's just on a complaint basis or if there's a routine, and we can get back to you on that. But we're working with EFCL to ensure that there's good communication out to the leagues. Certainly, there is some challenges. Certainly, in terms of some leagues being challenged to open their ice, and some others being challenged to close their ice. So there's not a universal approach, and there is a difference of opinions in terms of how they should be operated. So our NRCs are working with those leagues, but we're trying to work effectively with EFCL to make sure that there's, standard information going out to all the leagues.
And I guess, how do we communicate that standard to the public? Because that might help them reinforce the messages.
Yeah, we can take that back. Thanks, Councillor. We'll do that.
Thank you. All my other questions have been asked. Thank you.
Thank you. Councillor Paquette.
Thank you, Mr. Mayor. Yeah, just to put a pin in Councillor McKean's comments as well, we've got Kennedale Ravine on the north side that is a popular camping area. So maybe if people haven't checked into that, they might want to. There might be some folks who aren't aware of the assistance that they can be provided. I'm curious about what we're doing for community leagues who maybe are experiencing a lot of demand on their ice surfaces and they want to create more ice surfaces. Just quickly and, temporary sort of installations. Are we helping them to do that in a manner that is expedited so that we can decrease the crowding?
I don't have details, Councillor Paquette, but certainly snowbank rinks are more than permitted. If there's a proper location, there's no approval process. It really is just a matter of the league getting the staffing to do the work to build the rink. And our NRCs are working hand in glove with the leagues if they want to do that. If there is some expertise that we have internally, we'll try to communicate that in terms of making good ice and so on. So those wheels are kind of available, but we'll certainly double check to make sure that there isn't a red tape issue in terms of facilitating that work.
Okay, well, maybe we can be proactive on that because I've had some community leagues that are asking questions and they're not sure exactly if there is an approval process or if they can just go ahead and do it or what the situation is. So that would be really helpful, especially during this winter. I will just flag again the need for lighting in dark parks during the winter season. And have we gotten any movement on that in the past month?
Councillor, I'm going to have to circle back with you on that one as well. Don't have that information, but we'll send you and all of council a note on the dark parks lights. I know that the skidding facility at Castle Downs, I believe there's lights there, but again, we'll find that out.
Right. Well, I've gotten more than a few communications for women who would like to be able to use our parks, walking their dogs or exercising, but do not feel safe in the darkness. And since we're encouraging people to be outside, and a lot of people can't actually get outside until after their workday is done, if we have a cheap and simple temporary solution, maybe we can fast track that for them. Okay, my next question is, I guess, more of a medical one. And this is about the news that we're receiving about more virulent COVID variants popping up around the world and the impact that's going to have going forward. Reports are that perhaps the current vaccines aren't effective on this, and that these strains tend to spread faster, and that we're starting to see appearances of these strains even in Alberta.
No, thank you very much, Councillor Paquette. I think to speak a little bit more about the UK variant or the, South Africa variant now, it's first to acknowledge that viruses do change over time. We've experienced this certainly with the really genetic drift of our influenza, circulating influenza on an annual basis. Even SARS in the early 2000s actually did drift over time. Certainly what's been observed in South Africa as well as several other jurisdictions is that this SARS-CoV-2 with this COVID-19 virus itself has and will continue to mutate or will continue to gradually change. The effect of the change, as has been observed, is some change to what they call the spike protein, or this protein that's helpful and beneficial to the virus itself to help cause infection. The worry being that it may be more easily transmitted, or at least more easily cause infection in hosts and people that are exposed to it. The vaccine itself that we have, and our 2 approved vaccines in Canada are mRNA vaccines, and they actually provide and impart immunity to those who receive the vaccine against the spike protein itself. So that's when the ultimate effect of being immunized with the 2 available vaccines is you actually create antibodies against that same spike protein that is gradually starting to change over time. The current thought is that because the immunity from the vaccine itself is more general to multiple areas of that spike protein, the gradual changes shouldn't have much of an effect, but certainly it is concerning. And I know the manufacturers are looking at this very carefully to see if there have to be or should be adjustments to the vaccine itself, or what impact that will have to the immunization program overall. Ultimately, the measures that all of us have in place at our workplaces, at our houses, in our home environments, in our hospital environments is what we have to continue. We have to be able to have that safe for work aspect. We have to have the hand washing. We have to have the continuous masking because even if the virus does change in such a way that it's more easily transmitted, we still have to do those activities that limit transmission. So washing your hands, wearing a mask, staying 2 meters apart from each other, working from home, doing the safe for work aspects are all very critical things to helping stop transmission. And in addition to personal protective equipment in healthcare settings as well as others. Our immunization program is going to be the name of the game for 2021. And as more product is received in Alberta, we'll be able to expand that list and that list of eligible individuals to receive the vaccine itself. But we can't ease up on those restrictions, or we can't ease up on those precautions that all of us are taking to help protect one another. We have to limit transmission, whatever the virus is overall. So hopefully that helps.
Thank you. Thank you very much for that. Councillor Katarina is still on the first round, I think. Go ahead.
Yeah, thank you, Don, Mr. Mayor. Mr. Laughlin, on this over, especially December with all the changes coming sort of fast and furious from the province, from us, other jurisdictions across the country that people might be listening in on, is the challenges that people aren't quite sure because of sort of the 2-week cycle that we make decisions, or the province makes decisions on, or AHS makes decisions on, is really causing a lot of confusion for people. And I think that at this point now, there's sort of an information overload where they're not hearing what all these changes are on such a consistent basis. So the question to you is, should we, or we as a city, do we have the jurisdiction to, certainly following AHS and all their guidelines and the provincial guidelines as well, but do we have an option to sort of streamline the position of the city of Edmonton as far as restrictions, rec centers, all those things that are in place now, that we are not operating on a 2-week cycle or a 3-week cycle, saying, yes, you can open, no, you can't open 3 weeks later, all those sorts of things that really don't give any predictability to the citizens, to business, to employers, to employees of what they should be doing. And they all seem to be reacting at the last minute with the decisions that are made on that cycle. So are we in a position to do that, or have we thought about saying, okay, rec centers are not going to reopen until X happens, or the provincial standards are going to be what we're going to react to every time they make changes? I know that was long-winded, but sorry for that, Adam.
No, great question. And maybe just to sum, should we as a city be looking at kind of more definitive timelines as it relates to restrictions specifically around the city services? And I think that's a great question that we would take back and work with the task team on to see, does that provide more certainty for our citizens around services? So I think that's a great suggestion, Councillor Katarina. What it doesn't cover off are those restrictions that are out of our control, that are provincial. But you raise a good point that we could, for city services, be more definitive if we are considering a longer duration of restriction, that we could communicate that and not just work off, like you say, the 4-week cycle that we're currently in.
Yeah, that's what I've noticed, especially over the holiday season. Certainly, the relaxation to allow one person from out of the family to be able to attend parents' home for 5 days. 23rd to the 25th. That was an addition, and I think that all these rules, even though they might be terrific rules, are in place. I think now it's gotten to the point where there's so many changes and variances to these guidelines that I think people are well, I know I'm confused, and I can imagine anyone else looking at this, and I think they've reached a point where they're tuning out. And Catherine, I don't know if you've noticed that with communications, which ones are working or which ones maybe are not working, that we should be looking at again. But I think that if we, the city, within our powers, and I'm not suggesting that we go to a Seoul again at this point, but set some standards for ourselves on city programs and facilities, that there's a longer timeline for whether it's restrictions or lifting of restrictions. So there is a little more clarity from our point.
We have been doing our utmost, Councillor, to cut through the clutter and be clear about interpreting the rules for Edmontonians, but you're absolutely right. As they change, the regulatory environment becomes quite cluttered. So your point is an excellent one, and as Mr. Laughlin said, we'll look at it and see if we have the ability to do some scenario planning that will give us longer cycles to work with.
Terrific. Thank you very much, Catherine. Thanks, Adam. And thanks, Mr. Mayor.
No problem. Is there anybody else on the first round? Okay. So maybe picking up on that a little bit, I saw some of the joint messaging going out from the city and some of our regional partners. I think to Councillor Katarina's point, one of the cutting through the clutter on this is credible messages from local governments. And to the extent we can be united with others, I think that only adds strength and resonance to what we're doing. So thank you for the efforts on that. How many of our regional partners were we able to corral into that campaign ultimately? I was sort of counting logos, but just wanted to get an official count on where we're at on unified approach there.
I'll double check that as we're chatting, but I think all of the Metro groups were in. Is that right, Mr. Laughlin?
It depends on what was communicated. Broad communication, yes, all within the Edmonton region, and in fact it got expanded to the Edmonton zone. So no, those not just in the EMRB, but rather the...
So some of the smaller communities,
correct.
Your Thorsbys and Kalmars and others?
That's correct.
Oh, that's great, okay.
But for that video, I think it was just a few municipalities related to safe operations of I referenced it in my speaking notes.
Yeah.
But broad communications, it does cover the region plus.
Oh, okay, good. Well, thank you for that. I think that we've been beating the drum of regional consistency going all the way back here, and so I think that prepares us should the need arise for coordinated action. So I think that's important precursor work, but again, hopefully that isn't necessary. Hopefully the measures will continue to be put in place that are necessary from the order of government having jurisdiction and the strongest authority, meaning the province. So speaking of which, vaccination is in their bailiwick as well, and appreciate the information about the prioritization. As they start to think about the next waves of prioritization, though, my thoughts have been with our first responders particularly, who, certainly our bus drivers and others on the front lines of municipal service, are all potentially in positions of exposure and have been throughout, and we've tried to provide them all the PPE and safety and training they need, but particularly for firefighters attending to medical calls that might be respiratory distress, and for police officers engaging with the public in whatever circumstances the public may find themselves in during a pandemic, which sometimes involves close contact. Have there been conversations about our frontline workers, and particularly our first responders, and their eligibility on the earlier side of things for vaccination?
We have recently raised it with provincial counterparts, and we'll continue to advocate for that. I think what was good to hear was an openness to get perspectives from municipalities on possible rollout of the vaccination based on priorities. So we'll continue to advocate for that, and I would say that it's first responder, so it does cover off the police, fire, and EMS, although not in our control, so to speak. So we'll continue to advocate for that when they start to, with the continuing planning of the rollout.
Well, and peace officers have been asked to take on more, and we asked for them to be given the opportunity to take on more, to be clear about it, but so there are a variety of folks in direct contact with the public, sometimes close contact during periods of either distress or heightened tension, and so I'm glad that's in the mix. And maybe it's not really a labor relations question, but I'm sure that the labor units for fire and police and others would be engaged on these questions. Maybe to Chief Zatilny, if you've had a chance, I know the firefighters are particularly well organized in this regard. Have you had an opportunity to connect with them about advocacy on this point in through their various channels as well? I mean, I think the same would go for the police association, but maybe to Chief Zatilny, any conversations with the firefighters union about advocacy on this question of earlier access to the vaccine for your first responders?
Thank you, Your Worship. And yes, there have been conversations and efforts both by the association and with our provincial bodies as well to try to get firefighters who in some jurisdictions play a dual role, but in all jurisdictions look to support our EMS partners and our AHS partners in the work that they do and working with vulnerable populations, and sometimes go outside of their role to help our citizens. So we're hoping. There hasn't been anything that we're told to date announced yet, but looking forward to supporting our staff on the front lines with the vaccination.
All right, I think we're all on the same page there then. Thanks for that. I'm out of time on the first round, so unless there's anyone else who's been added to the list, we'll start the second round with Councillor Knack.
Thank you, Mr. Mayor. I think I just have one more question related to testing facilities. So I had received a couple messages from folks asking about ease of access to different COVID testing locations in the past. And I don't know, I was double checking the website and I don't see a list of where they're located, or if there's still only the one that was further southeast. But I'll just ask this, is that how accessible are some of these locations, or are there multiple locations by transit? I had some folks in the West End who were saying that they found it very challenging to go get tested because there wasn't anything nearby and the transit trip was going to take some time. But there might be some in the West End. I don't see anything online, so I don't know if anyone has any details.
Yeah,
we haven't made any specific adjustments to our routing or coordination with respect to the facilities. We can certainly take that offline and see if there's some opportunity to ensure that there's a better degree of accessibility through transit, but we can take that away and see if there's that opportunity.
Okay. I think, was it Dr. Sikora was going to jump in there?
Yeah, and I guess I'll just add that we do have the self-assessment for Albertans for COVID-19 online and the ability to actually schedule an appointment for that testing itself. We were very careful to ensure that the testing locations, the public access testing locations, did have at least acceptable transit access. But they aren't the only game in town. There are many family physicians that do have test capability, and I guess those are always other alternatives as well.
That's helpful to know. I just knew of the main locations, but even if there's some physicians that do it, that's great. That helps answer my question. So thank you very much.
Yeah.
Thank you. Next was Councillor Banga.
Thank you again. And again, my question for EPS would be, we had a situation, I guess it was in Calgary, at a skating rink or something, where somebody had to be physically tackled. In Edmonton, did we have any of those situations? Question is for EPS and also for bylaw. I guess they're both doing the same.
Hey, Councillor Banga, Dean Hilton here again. I can say that to my knowledge, we've had no incidents like that. We've definitely messaged out to our members again the importance of trying to advocate for the Public Health Act, making sure people are following the orders. With that said, we've also told the members to be cautious. When you approach those types of situations, we don't always have to enforce at the time. We have the latitude to try and identify people. We can come back later, but again, realistically, we don't want to put our members in a bad position where we're trying to enforce a bylaw and somebody ends up getting hurt. And I see a lot of bad things happening with some of these situations. So again, not turning a blind eye and not saying we're not enforcing it. It's more picking and choosing the when. So if we can identify people and address it that way later, that's probably more beneficial. So I hope that answers your question.
It definitely does. Again, one more question in regards to that is, I was looking at the public, I guess, monitoring and compliance data. We have enforcement actions 1,229. It includes warnings, tickets issued and referral to AHS. Would you be able to comment on, I guess, the actual number of tickets that were issued to people?
I actually have that, Councillor Benga. There's been 98 tickets issued related to mask bylaw infractions and 9 tickets that have been issued for infractions against the Public Health Act, and that was between December 10th and January 4th.
Okay, that's great. And I had a couple of other questions about number of hospital beds available. And in Quebec and Ontario, this is a big issue. Are we to the same extent here in Edmonton zone?
Specifically, do we report the community deaths versus hospitalized deaths?
Yeah.
I don't think we split those apart in the public reporting, Councillor Banga. Mm-hmm. I can take that away to see if that might be something that could be looked at. I know certainly we do have the reporting online with respect to the age group or age ranges of unfortunate deaths. But yeah, I can take that one away.
Okay. And one more question in the same line of questioning is, I guess that for the city official is isolation facility is running at 30 to 50%. Can that be used, the vacancies in there, can that be used to, I guess, complement any other facilities?
Councillor, at this point in time, that entire facility is dedicated to that one purpose. The shelters that are providing over the last few months did allocate some of their bedding to like isolation areas within their own shelters, but more and more the agencies are using that one central location to provide housing basically for people that need to be isolated. So at this point in time, and certainly Alberta Health Services is leading that piece of the service levels. So at this point in time, I think there's a consensus that having that dedicated facility for that one purpose is the way to go.
Thank you. With all these phases of immunization, the city of Edmonton doesn't have any jurisdiction or recommendations to Alberta Health Services, do we?
We don't, Councillor Benga, but as we have throughout the pandemic, we stay in close contact and discussions with Alberta Health Services and the provincial government on what we can do to help during the pandemic, and I don't see that changing with with vaccine rollout. So we will be there to help, and as I said earlier, advocate for access to the vaccine for those that we feel are at risk from our perspective within our services.
And certainly on the Alberta Health Services side, the offer of assistance has been heard, and once I think we're in a position to be able to identify how best to utilize that offer, we're going to continue our discussions and go from there.
Thank you.
Okay.
Thank you very much, Councillor Benga.
Mr. Mayor, let me know when my time expires because
I'm afraid it's up.
Okay, thank you.
Yeah, no problem. Councillor Zadig.
Thanks. Just quickly, further on the discussion of the vaccine rollout, I think there's a lot of wisdom in the groups that were identified, and also advocacy for civic frontline workers. But once we get past some of those groups, just thoughts about, before it gets to the general public, it occurs to me that, cashiers in grocery stores, retail workers, wait staff, and then even like chiropractors and registered massage therapists, these groups that interact with the public and have been keeping the economy running throughout, has there been any discussion about a subsect of a healthy population but those workers that are dealing with the public on a daily basis and have really been putting their health on the line throughout the whole lockdown and all that? Are those workers identified in the subsect?
Well, so I mentioned earlier that policy around vaccine distribution is something that Alberta Health determines.
Yeah, the question wasn't necessarily to you.
But we don't have anybody from Alberta Health on the call. What we have is Alberta Health Services who are responsible for the distribution. So the policy is defined by Alberta Health, and Dr. Sikora can help with this if I'm misspeaking, but I believe policy is set by Alberta Health in terms of obviously informed, and that's where we hope we can inform some of that. And then the distribution and the actual delivery is facilitated through Alberta Health Services.
And you're right. I think it is a good policy question, and certainly Alberta Health is best situated to be able to respond to that. And I know they have taken the approach that in this time where we have relatively limited access to product, we do have to be very careful with how we use it. So where is it going to make the most, where is it going to have the most benefit? And as Alberta does receive more and more doses, we'll be able to open up to more and more population groups overall, with the ultimate intent of having a vaccine available for every Albertan. Now, that's going to take probably a large part of 2021 and is, of course, dependent on so many factors, and receipt of vaccine pallets is going to be one of those. But I know these are very heated discussions at those Alberta Health tables, and I know they are balancing many of those regulated workforces that you have mentioned, as well as many of our workforce groups. And certainly those organizations have made their opinions known and will continue to advocate for their membership, and that's certainly very appropriate.
Thanks for that. Just switching gears for my last question. I was at the Alberta Legislative Grounds noting their holiday display with lots of lights and noting a lot of families were out there as well, particularly with this warmer weather. But on my way there, I drove past City Hall and I saw that our tree was not lit up and Churchill Square was dark. And I don't know if there's budget reasons around that, but just given that I think we're encouraging people to get out and safely distance and to enjoy the city and obviously stay local. And we've lost people from visiting Churchill Square due to construction last year. Just, is it intentional right now that the lights are off? Because with an analogy of keeping buses running fairly regularly so people can space out, if there is a demand for going for a walk when it's warm out and seeing different holiday lights, as is occurring at the Legislative Grounds, why are we not doing that here at Churchill Square?
We can follow up on that. I wasn't aware that we've actually got the lights shut off. There may have been some, for video footage related to the World Juniors, there may have been intermittent lights off so that they could get good video shots of City Hall, but I'm not aware, so we can take that back and follow
Understood.
up.
Thank you.
Yo, got to get those Insta captures of City Hall just right. So lighting is everything. Who is next? I don't have the list up. Councillor Paquette, go ahead.
Thanks. The lights are on. Okay, so just curious about going forward, since we know that we've got a path and it is fairly lengthy. Do we have something for the public to detail that path with them and sort of a decision tree so that they're sort of partners in this rather than kind of just, as Councillor Katerina alluded to, just kind of being confused about what's going on and why and how? Are we going to be providing the public with some sort of concrete document that they can refer to so that they can be partners in keeping everyone safe?
So as Ms. Owen said, Councillor Paquette, we do try to synthesize the information and provide what you describe on the city website to ensure that it's clear.
Well, I'm fairly engaged, and this is not on my radar.
So, for example, we put out just as one illustration of this, we put out a Play Safe video series through social media. But your longer term point is really well taken. I think we need to look at navigational support to Edmontonians over the next months and what we can do to help tell the story of what they can expect and how they can become resilient to what is transpiring. I think that's something that the task team can take away and work with ELT on, and we can update you on in future EAC meetings, if that makes sense.
Yeah, no, it makes sense. I think that would just be very helpful for the public so that it seems to the public, I'm sure, that a lot of decisions are made ad hoc. And to that end, does administration, regardless of maybe not regardless, regardless of what the province does or does not do, do we also have a map for what we will or will not do, or are we proceeding on an ad hoc basis? At this point in the timeline, it seems that we should be a little bit further ahead in that kind of approach.
Related to what specifically, Councillor Paquette?
Actions on COVID, what happens if X happens, what happens if Y happens, the whole ABCs of decision trees.
Well, as we've articulated previously, decisions around public health restrictions are not under the jurisdiction of the City of Edmonton. We may take steps if we're feeling there's an issue, but again, we follow the lead of the provincial government around the health restrictions associated with the pandemic. And
I'm saying, is there something we can do that's a little bit more reassuring to the public than just, let's just see which way the wind blows?
I think we've been trying to do that, Councillor Paquette, respectfully.
I agree. I'm talking about the communications with the public about that. Because they may not know.
Just to reiterate, I think your point about navigational support over what will likely be a long winter would be really advantageous for Edmontonians. So the task team and we will think this through and determine what within our bounds of responsibility we can possibly do to anticipate and therefore communicate in that anticipatory way.
Right. Okay. Thank you. I mean, clearly everyone's working extremely hard. It's just good to show our work to the public. My next question is, have we seen I'm just curious about how things are going emotionally, I guess, with the public in regards to our calls to the city or to EPS. There's economic frustrations, there's COVID frustrations in the public, and we see that coming out and being expressed sometimes in family or domestic violence, or, and is there a concern that this extends into public violence? And, do we have plans for that?
Councillor, you're correct in that the trend lines are generally up. Certainly calls to the distress line and the indicators of domestic violence. Certainly comparing this past year to the previous 3 years, there is an increase in both of those areas. So there's no question. But the community organizations that are involved in this area certainly have been doing a lot of what we believe really good work. They're certainly aware of that. So the services that they're providing, and even the gender-based violence program that the city launched a while back, It's Time, that's on Twitter and Facebook. Really, it's gotten a lot of hits, if you will. It's reached over 100,000 people. So there's obviously people that are reaching out to those kinds of resources, and certainly our staff in our social development area are connected to those agencies and are working hand in glove. But it certainly does take a whole community to address that, and we believe those wheels are in motion, and the expertise is really embedded in those community organizations.
Thank you. Councillor Caterina?
Thank you, Mr. Mayor. Just following up on Councillor Knack's questioning, with the challenges that some or many are not being able to either access a test and where those locations are. I'm not aware of where they are, but this is maybe for Dr. Sikora. Is there a specific reason, and maybe I'm wrong, but why pharmacists or pharmacies are not providing or allowed to provide testing? Is there something that we don't know? Because there are thousands of pharmacies around the city, and that seems to me to be the most accessible for everyone involved. And they administer influenza shots, and this would be strictly for testing at this point, not for the delivery of vaccinations, which I understand are in the works. But is there a reason why people can't go into a pharmacy and be tested?
Earlier in the pandemic, we did have a testing process that was undertaken. I guess in early November, we had taken out the ability of pharmacists to test asymptomatic individuals, and ultimately in a mechanism to be able to, I think, streamline and ensure that we get all that important information related to contact information, contact details. The testing centers themselves were seen as the most efficient way to be able to do this overall.
Okay. So have we, or has the province, or are you satisfied with the number of tests that are being conducted? Like the provinces or AHS is happy with that, or would they prefer more testing? And for those that access is difficult for whatever reasons, has that been considered on allowing pharmacies to test not just asymptomatic, but to provide testing if someone wished it or required it.
So many industries also have testing capabilities through private systems overall, and that's been something that has been implemented across Alberta in many different business settings. The public access components are, I think, respectable. I think we're able to get somewhere between 15 to 20,000 tests processed per day through the established infrastructure, which is pretty good. And being able to, I think, be able to drive that testing should only really be done in those symptom, at least derived by or at least driven by symptoms, is certainly best practice. An asymptomatic test that's undertaken is exceptionally difficult to interpret. It doesn't really mean a lot. So being able to have symptom-derived testing is certainly the preference, and something that is at least supported by the evidence from many other jurisdictions.
Okay, I'm not quite sure of the answer to that or whether I understand it, but let me keep going here. So from the pharmacists, in order to provide this testing, I know we talked earlier, Mr. Laughlin, about what we have the power to do or not do or control over, and we certainly have control over city-owned facilities that are available if testing for many people is seen to be prohibitive because of whatever reason, whether it's transit, whether it's time, whatever it happens to be. But given that pharmacies aren't doing it, I guess my next question would be, we have 4 rec centers in the city, in all quadrants of the city, pretty well, whether we have thought about offering those facilities up to the province in order for them to provide the personnel to actually do this. If there's a problem with pharmacies doing it, I imagine that we would have a problem as well. But I want to put that out there that we have facilities that are closed that could be accessed for testing, and maybe that would be a trial for a vaccination as well too, to get some insight on how the vaccination distribution could be done better or quicker going forward in the next number of months.
Absolutely, Councillor Katarina. Those are things that we could offer and will offer. And specifically on the vaccine component, that would be what we would be offering to help in any way, is that you need a facility, we'll make sure that we can provide a facility. And if there are concerns about access to testing, we can also raise that with our AHS folks as an opportunity to help.
Yeah, I think that we should be proactive in this and make that offer prior to it coming. And there might be logistical reasons, and there might be technical reasons and health reasons why they might not consider those offers. But I think that it's would be our role to at least make the gesture forward to the province that these facilities are available, and if it would help with distribution and testing, that we're prepared to do that for them.
You bet.
Thank you, Adam.
Thank you. Councillor Paquette?
I do believe Councillor Hamilton has clicked on, and she might be.
She's still in the second round. Go ahead, Councillor Hamilton. Thank you.
Hi, thank you. I just wanted to check in again with EFRS to see if we had an update to the radio piece.
Thank you, Councillor Hamilton. So up until January 4th, there was a gateway between the new radio system and the old radio system that would allow scanners to listen into our AFRAX channels if they were encrypted. And as of Monday, this gateway was decommissioned, which meant a scanner could no longer listen to the AFRAX channels just by scanning the old system. And so currently we have approximately 42 channels, and there are 7 of those channels that are encrypted. But outside of that, the remaining 35 are still our media partners, and those with scanners can still scan those channels and are able to listen in on what's occurring at calls.
Do we have, do you have any detail on like the difference between those 7 channels and the remaining 35?
The details I have, so the 7 that are encrypted really deal with tactical, hazmat, technical rescue, that type of channel where we wouldn't want that to be listened in on, not because of hiding, but there is work that's being done, close quarters around patients, that type of thing. But the remaining channels are still open.
Okay, and there was some conversation about how in Calgary, media had been granted access to specialized radios. You know, is that would allow them to listen in? I was wondering if you had any details on that specifically, or.
I don't have those details. I do know that they can, for most of our communications, they can still listen in. It had little effect to us, but that's because we left most of our channels unencrypted.
Mm-hmm. And for some clarity, you know, sensitive information, oftentimes emergency responders will pick up their cell phones and call someone, correct?
That can happen, correct?
Yeah. So if it's really sensitive, all right. Thank you for looking into that and getting back to me.
Yep. There are cell phones on our apparatus as well that allow that to occur. Maybe.
All right. Thank you.
Thank you.
Thank you, Councillor Paquette.
Thank you. And since you're on the line, I'll just continue with EPS related question. Didn't quite get covered last time. There's a concern about growing frustration over the timeline of COVID, economic frustration, and frankly, some of it's being stoked by people who should know better. But what we're seeing is maybe a normalization of violence and a normalization of public violence. So I'm wondering if EPS is watching that, has a plan for that, and what we can expect going forward.
Hey, Councillor Dean Hilton here. I don't know if I can specifically answer your question, but I can tell you that we are monitoring our statistics pretty closely there. We're monitoring the violent crime related to what we believe might be masking bylaws, those types of things. Again, the encampment piece, we're watching that. The domestic violence, we're watching those numbers. They are above, obviously, the last year and the 3-year average there, as well as the mental health that was addressed earlier there. So we're definitely looking at strategies to address those things. We've redeployed various resources into certain areas, and we're continuing to strategize to use our resources most effectively as possible to respond to the various types of themes that we're seeing. So in a nutshell, yes, we are aware. I think the mental health is one that really concerns us the most with people, and the longer people are in lockdown, the more concerned we get. But again, we have seen an increase in some of the violence on the street, the guns, obviously, that we're recovering. Last year was a tough year for homicides and those types of things. But I think the chief has explained that pretty closely, that we're definitely paying attention to what's happening out there and just trying to be as proactive as possible and putting remedies in place to help try and predict some of that.
Yeah, the past couple of weeks of news has not been great. So thank you for that. Okay, so one last question for AHS, I think, or Alberta Health, is one of the things I've been hearing from folks with disabilities is that it's extremely onerous for them to get testing. It is a voyage of multiple hours, especially during cold weather or during snow, which greatly impacts their mobility. And I'm just wondering if there are any approaches that are going to help with that, maybe specialized services or anything.
Well, thanks for the question. There are some specialized services, and certainly some of the more congregate living environments do have the ability to test in-house and to be able to do those swabs for individuals that have symptoms that may be related to COVID-19. But certainly, yes, I hear the feedback that for the public access testing sites, they may be difficult and may take a long time to be able to get to, especially on public transit environments. The booking of a test through 811 may be utilized, or at least people may be able to chat with one of our nurses on 811 to explore what some of those other options may be. That could be something that could help those individuals.
Okay, thank you very much. That's really helpful, and hopefully we can get that information out to folks so they can share it with people. And then the last question, of course, is people who maybe are on the edge of poverty or living in poverty and don't have access to transportation. Is there anyone they can call? Perhaps they don't have a network of friends or family to help them if they find themselves in distress or just concerned. And maybe they, rather than taking an ambulance, which obviously they can't afford. Of course, 811 might be overwhelmed. So is there any idea of how to help those folks? Because those are generally sometimes our frontline workers as well.
Councillor, what we try to do is encourage folks to use the distress line 211, and they can then triage those calls, if it isn't an emergency, of course, to the right area, or 311, and they connect as well. So we try to use those institutionalized systems to support those populations, and certainly those community agencies that we work with day in, day out are well versed in supporting those individuals. But I certainly take your point that there may be some people that may not be fully aware of how to make those connections and who to call when they are feeling distressed.
And certainly, I would reinforce that 211 is a good resource for all Albertans, including those in the Edmonton area around this, to be able to identify what those lists are of possible resources to support one who might be just on that borderline edge of poverty.
Thank you.
Any other questions? Not seeing any, then I'll take a motion to receive the report for information.
So moved.
Thank you, Councillor Banga. Is there any debate on that, or can we go to the vote?
No debate. I just want to give a great thank you. I know I asked a lot of questions, took up some time, so I appreciate it. And I'm really grateful for everyone's work. I know I asked some tough questions. I didn't mean to be tough on people if it was perceived that way. Thank you.
Thank you, Councillor Paquette. Anything further before we vote? Not hearing any, please vote on receipt of information.
Madam Clerk, I'm a yes.
Thank you. Councillor Katarina?
Yes, as well for me. It
Thank
hasn't
you.
come up.
We're good to go.
Display the vote. Carried. Okay, that's the business for the Emergency Advisory Committee meeting. So we will adjourn this meeting, and I suggest it's basically 3:30 now. So why don't we? We'll just take a few minutes break. How much time do you need for the clerk?
Just probably 5 minutes. Is
5 minutes. Okay. So why don't we? Is everyone okay if we take about a 5-minute break and then aim for 3:30 to reconvene for the council meeting? All right. let's do that then. So we'll see you back here at the bottom of the hour. This meeting is adjourned, but don't go too far. We'll get the other one started right away. Stand by. Thanks.
Mr. Mayor. Mr. Mayor.
And we
All right, welcome back to the January 7th special council meeting. I'll call us to order and roll call, this time starting with Councillor McKean.
I think I'm here. Can you hear me?
Yes, we can. Thank you. Welcome. Was Councillor Nicol able to join us for
no,
this?
we've received
No?
notice he's unable to attend this
Okay,
afternoon.
understood. Councillor Paquette? Councillor Paquette? Okay, we'll come back to him. Councillor Walters? Let me know his meeting's wrapping up soon. He should be able to join us still, but not quite yet. Councillor Banga?
Present.
Thank you. Councillor Cartmel?
Good afternoon.
Thank you. Councillor Katarina?
Yes.
Welcome. Councillor Zadig is still live and on deck. Councillor Essinger?
Good afternoon.
Afternoon. Councillor Hamilton?
Good afternoon.
Welcome back. Councillor Henderson?
Yep, here.
Thank you. And Councillor Knack?
Good afternoon.
And Councillor Paquette, are you on the line?
I am, just not used to being first.
So that's 11. That's plenty to get started. I need a motion to adopt the agenda with the two items on it, 6.1 and 8.1.
Happy to do that.
Thank you, Councillor Essinger. I do need a seconder because it's a council proper. Sorry, who was the seconder?
Seconded, Mr. Mayor. Councillor
Oh, Councillor Knack. Okay, there you are. Thank you very much. Any questions on the agenda? Not hearing any. Let's vote.
I'm a yes.
Thank you, Councillor McKean.
Yes for me as well, Madam Clerk.
Sorry, thank you, Councillor Katarina and Councillor Paquette. We're good to go, sorry.
Thank you. Display the vote.
It passed unanimously, sorry.
Okay.
We'll get the display up in a few seconds.
Thanks. Well, that's carried. Protocol items, we do have one. Mr. Laughlin agreed to a short tour of a few months as our interim city manager while we embarked on the search more than a year ago. And of course, here he is still after a year in the job. And he would be the first to say that his success was not his alone and that it was shared with members of the executive leadership team and really everyone who works here at the City of Edmonton who've pulled together through a really extraordinary time in this city's history. But we would not be where we are without Adam's steady hand for the last year, far above and beyond the expectations and the assignment that he was given. And I checked in with him a couple of times to make sure he was still on board for this as we worked through it. And he was unhesitant each time to carry on with this responsibility. Not just because of the times we're in, but because of the man he is. And so I actually get emotional talking about it because I am so proud of Adam and his leadership, and very grateful to have had the chance to serve with you for this past year, and look forward to continuing to work with you even as the roles adjust and the new city manager starts in a week and a half's time. And so this is the last time Adam is before us sitting in that chair, at least for now, maybe down the road. I have high hopes for his future and his career at the City of Edmonton and public service. And as I've said to him, but will say to all of you, he will always have an unqualified positive reference from me for whatever that's worth. And I'm sure from many of us up here. So I'm sure on behalf of all of us here on City Council, sincere gratitude for your steady hand and not just sort of keeping things moving, but really helping to advance this council's agenda with important projects like the city plan, really extraordinary and tough decisions through several budget adjustments, a really remarkable track record in just over a year. And so I wanted to first ask for a round of applause from my colleagues here and anyone else who wishes to join in to Adam with our gratitude on behalf of Council and the people of Edmonton for your service. And I got you a little something on behalf of us here that I will present to you in a moment. That is what a small token of my personal appreciation for your leadership, Adam. But many thanks again from all of us here for your leadership. And it's been really cool to see you grow from a very good leader into an even stronger leader through this time. And just much thanks.
Can I say something?
You may.
First off, I wasn't expecting this, so thank you very much. Very humbling. I'll say it and I'll continue to say it. Couldn't have done this without the support of a tremendous leadership team, tremendous staff at the City of Edmonton, and the support from Council. So I don't do well at these kind of things, so I'll just leave it at that and say thanks. It's very much appreciated, so thank you very much.
I'll give him another round while I deliver his goods here. All right, so any other protocol items? Okay. All right, selection of items for debate.
We actually did have never mind.
Selections, well, let me just check. We must select 8-1, I think.
Nope.
Oh, we don't? We don't must select it. There is a recommendation there if you're satisfied with it. We will go into private if there's any discussion on it. But let me just see then if there are any selections. Does anyone wish to select either 6-1, the amendments to the election bylaw, or 8-1, the Community Safety and Wellbeing Task Force vacancy appointment? Okay, this can be a real quick meeting then. Then we'll vote on reports not selected for debate. So that would actually be 8.1 first. Someone want to move the recommendation in 8.1?
So moved.
Second.
Was that Councillor Knack, seconded by Councillor Paquette? Okay.
I think it was Councillor McKean.
Oh, sorry. As the mover or the seconder?
Seconder.
As the seconder. Okay, so Knack McKean, move 8.1. Please vote.
Yes.
Yes, Madam Clerk.
Thank you. We've got the appropriate responses, and we're just counting up the votes. We're just waiting for one.
We're
good to go.
Very gentle, Madam Clerk. Thank you. I forget that it's 2 clicks. I'm used to 1. I'm old school. What can I say? Okay, display the vote. And that's carried. Okay, and then bylaws not selected for debate would be 6.1. Someone want to move first reading of bylaw 19457?
So moved.
Second.
Thank you, Councillor Zadig, seconded by Councillor Banga. Please vote on first reading.
Yes.
Yes.
Yes, Madam Clerk.
Thank you, Councillor Caterina. Councillor McKean, we've got all the votes, Mr. Mayor.
Thank you. Display the vote. Carried. Can we do unanimous consent now that we know that it's unanimous, or should we keep on voting like it's going out of style?
For this one, let's just keep voting.
Okay, yeah, this one's kind of a thing. Okay. Let's not introduce any risk to the elections bylaw. Orderly transition of power, that's going to be the theme for today. Please, you want to move second reading? Okay, thank you. And Councillor Banga, you want to second it?
Definitely.
Super, okay, please vote on second reading.
Yes.
Yes, Madam Clerk.
We have all the votes, Mr. Mayor.
Display the vote. Carried. I've gotten in the habit of taking consent for going to third if all the other votes are unanimous. So is there any objection to advancing third reading? Not hearing any, then you want to move third reading?
So moved.
With unanimous consent to do so. Thank you, Councillor Banga. Please vote on third and final reading.
Yes, Madam Clerk.
Yes.
Thank you. We have all the votes.
Display the vote, please. Carried. Are there... Oh, no, there's no notices opportunity at a special council meeting. Sorry, folks, if you had one stacked up, it'll have to wait for committees in, what are we, 9 or 10 days out? All right. So this temporary interruption to your recess is concluded. We'll see you back on the 18th for executive committee, unless we need to assemble before then, but hopefully we won't. So thank you for making accommodations today to get EAC, and then especially to deal with this vacancy on the task force in a timely fashion to help them carry on. So I don't think we have any further business today. Thank you all. This special council meeting is adjourned.
Thank you.